Welcome back to Plastic Surgery Untold, greatest podcast in the world, is voted by us. We actually have world-renowned facial passion because you're a plastic surgeon, so I don't want to say facial plastic surgeon, Dr. Adam Weinfeld, who also has helped and just recently had a webinar on fat grafting of the face using some new technology called Lipocube, which really creates this nano fat grafting, but it's all about the precision placement of fat. And so fat has been such a hot topic for years, but really cool how you've really kind of made this a little bit more precise for either just in combination with facelifts, or it could be a standalone procedure in its own.
Yeah, and we've used it in both capacities. So what we're talking about here is a device, relatively inexpensive device that we've added to our practice that allows us to really take fat grafting to the next level. And it's the Lipocube Nano. And basically what it does is it allows us to process the fat that we get from patients for fat grafting to the face in a way that gives us very consistent results, very consistent consistency or flowability, if you will, of the fat. And what's most important is it gives us two types of fat. And those two types of fat are the micro fat, which is very similar to the structural fat that we have always been using, and then nano fat. And that's where things get really exciting, because this nano fat is fat that is broken down to very small particles, just a little bit, a couple of cells, and and then the extracellular matrix that is full of all of those goodies that are very helpful for restoring the quality of the skin. So really exciting that we get those two different types of fat.
And this is some of the things we've talked about in terms of this whole regenerative medicine and people not wanting to be overfilled, because you're actually using some of the fat, for volume replacement, because when we talk about facelifts, we're not trying to make people look like they're windblown and overly tight, but you're also using it to really help restore the skin, restore some of that youthful appearance that is such an untangible.
Yeah. Beauty is both skin and bone deep. And so the micro fat, which is the structural fat, the first component of the fat that the Nanocube provides, that we inject deep along the bone to help build up structures that have become smaller with age, such as the upper outer portion of the cheek, to help really supplement the lift in a facelift, let's say. And then also one of my favorite areas is adjacent to the nose in what's called the maxillary bone, adjacent to the piriform aperture. And what that does is that helps us make a much smoother nasolabial fold and crease. I love doing it as a little tiny chin implant in patients who have a weaker chin, and then also a really powerful area. And I'm talking about this all in the context of facelifting, although it can be done in isolation as well, but also injecting the temple to reduce some of that temporal hollowing that comes both in men and women with age. All right, so that's the bone deep level of beauty. The skin deep level of beauty, when we're thinking about the nano fat, the Lipocube Nano, is the nano fat. And that nano fat is, you can think of it almost like hyperdilute
radius?
Thank you. Hyperdilute radius, where you're injecting it just beneath the dermal layer or even into the dermal layer, and it has a biostimulatory reparative effect where you're getting the stimulation of both collagen and elastin production. And with that, you can reduce some fine lines and wrinkles. You can get a really beautiful glow to the skin, potentially even some homogenization of the color, so that you can even just get sort of a more homogeneous color to the skin. It's a really, potentially, but it's a really powerful adjunct to a facelift that we did not have in the past.
And the really kind of interesting thing about that is most of us that are in the kind of facelift age range, though that's opening, as we talked about in a previous episode, please check that out, is that most of us got our first really good sunburn of the summer when I was a little kid. And so we've done damage to our skin for years and years and years. And so unfortunately that ship has sailed. But now to be able to use some of these regenerative techniques with like Lipocube Nano to really repair the skin itself, I think is super exciting.
Yeah. I mean, I think we can think about it as part of an armamentarium of ways to improve the quality of the skin, whether it be plus or minus surgery, and when I say surgery, plus or minus a facelift. So we've got the nano fat. You could do that in combination, over sort of a treatment plan with the radiofrequency microneedling, and then even some of the light-based therapies. There's a lot of things that you can really kind of throw at the skin, if you will, in order improve the quality of it and improve the quality of our surgical results.
And really goes into the overall concept we've talked about in previous episodes of really trying to restore the entire facial features, but without just over volumizing people. And it's something that we've moved away from in our injectable practice and facelifts too. You want to find that fine balance of restoring the volume and structure that they've lost, but not just trying to overly fill them, but you can actually treat the skin without overly filling people.
Yeah, that's a really important. Obviously, fat grafting against standalone or with a facelift needs to be customized for the patient. And even patients who are slightly heavier do benefit from fat grafting. But in those patients, I'm a little bit more careful about how much I use because, as you said, those types of patients or patients who have recently lost a lot of weight don't want to look heavier than they are.
Any other kind of plastic surgery pearls about fat grafting and some of this new technology that you'd like to leave them? Because it's super exciting. We've just scratched the surface because you're actually pioneering a few other fronts that'll be coming soon in future episodes of being able to even further tailor this fat processing to really hit a spectrum of different needs.
Yeah. Well, I think one pearl is that fat grafting benefits almost every face and neck lift, so much so that I don't really offer it as a standalone item. I just say it's part of it. If patients choose not to have it, that's fine. But we just sort of bundle it in with the whole package for patients. And then also, again, as a standalone procedure, it can be really beneficial for patients who don't have a lot of laxity where they need a face and neck lift, but they've had some volume loss or just some areas where they don't want to continue to have filler after filler after filler because, fat grafting, after we have the initial decrease in volume of about 30%, the rest of what is there should stay. And then if we're going to be doing it as just fat grafting, we can actually do that with the patient awake.
That's so exciting. And I know you got a few more things coming soon. So excited to have you talking about that as that launches in the next couple of months. I think it was super cool to have somebody who's the world expert. You actually have done the webinar and the trainings for the LipoCube Nano. So to be able to have that in our practice and you share the knowledge directly with us is super exciting. So thank you. Plastic Surgery Untold, greatest podcast in the world, is voted by us. We'll see you soon. Please feel free to download us anywhere you get your favorite podcast. Spotify, Pandora, iTunes. We'll see you soon. Bye.
My pleasure. Thanks, guys.